Welcome students. In our last lecture on artificial intelligence and machine learning in biomedical instrumentation and sensor, we have seen how AI and ML are revolutionizing the field of biomedical instrumentation and sensor, leading to improved healthcare outcomes and groundbreaking research. In today's lecture, we will explore about telemedicine and its application. By the end of this lesson, student will be able to define telemedicine and understand its significance in healthcare, identify the various applications and benefits of telemedicine, describe the challenges and limitation of telemedicine. Lastly, list the different technologies used in telemedicine. To begin with, let's gauge your prior knowledge and experience with telemedicine. What do you think telemedicine is? It is a branch of medicine that deals with telecommunication technology. Your second option is a method of providing healthcare remotely using technology. Third option is a system of online medical consultation. Your last option is a type of healthcare insurance coverage. The correct answer is B. Any of you ever used or witnessed telemedicine before? If yes, now let me introduce to telemedicine. Let's start by defining telemedicine. Telemedicine refers to the use of technology to deliver healthcare services remotely. This can include video conferencing, remote monitoring devices, and electronic health records. The significance of telemedicine lies in its ability to provide access to healthcare, especially in areas where medical resources are limited. Imagine being able to consult with a doctor without needing to travel long distances and for waiting long hours. Here, I am showing you a descriptive diagram and we will discuss it one by one. Let's start the description of the diagram. The first is patient location. This is where the patient is located, which can be their home, any rural area or any place where they have access to the required technology. Next is healthcare professionals location. This represents the location of the healthcare provider who could be a doctor, specialist, nurse or any other medical professional. The third, as you can see, is telemedicine technology. This encompasses various technologies that enables remote communication and consultation between the patient and the healthcare professional. The next we will see virtual consultation room. This virtual space is created through video conferencing software or telemedicine platforms. It allows the patient and the healthcare professional to interact in real time, just like they would during an in-person appointment. Now, we will explore the steps of telemedicine interactions. The patient initiates a telemedicine consultation by scheduling an appointment and receiving instructions on how to connect using a computer or smartphone or a tablet. The patients log into the virtual consultation room at the designated time. The healthcare professional also logs into the virtual consultation room from their end. The patient and the healthcare professional can see and hear each other through video and audio communication. The patient discusses their medical concerns, symptoms and medical history with the healthcare professional. The healthcare professional can visually assess the patient condition, if applicable, and ask questions to gather more information. Based on the discussion and examination, the healthcare professional provides medical advice, recommendations, prescriptions or further steps. The patient and healthcare professional can exchange information, documents and test results electronically. During the consultation, If needed, the healthcare professional can schedule follow-up appointments for continued monitoring and care. Now we will see some applications of telemedicines. We will explore the various applications of telemedicine in healthcare. The first application in this series is remote patient monitoring. Remote patient monitoring, often known as RPM, is a healthcare practice that employs technology to track and transmit patients' vital signs, health metrics and medical data from their homes to healthcare providers by utilizing wearable devices, sensors and mobile applications. RPM allows healthcare professionals to remotely monitor patients' condition such as heart rate, blood pressure, glucose level and more. This real-time data enables timely interventions, early detection of changes in health status and personalized care adjustments, particularly beneficial for patients with chronic illness or those recovering from medical procedures. RPM enhances patient engagement, reduces hospital readmission and fosters proactive healthcare management, ultimately leading to improved patient outcomes and more efficient healthcare system. The next application we can see is teleconsultation and teleconferencing. Teleconsultation and teleconferencing in healthcare refers to the remote interaction between patient and healthcare professionals through video communication platforms. These virtual consultation enable patients to discuss medical concerns, receive diagnosis, treatment recommendation and even prescriptions, all without the need for in-person visits. By facilitating real-time visuals and verbal communication, teleconsultation and teleconferencing enhances accessibility to medical expertise, especially in remote or underserved areas, minimize travel-related inconvenience and provide a secure and efficient medium for healthcare delivery, ultimately contributing to patient-centered and convenient healthcare services. The next application is teletriage and emergency services. Teletriage and emergency services via telemedicine involves the remote assessment and initial management of medical conditions and emergencies, allowing healthcare providers to evaluate patient symptoms, prioritize care and offer guidance through technology. This approach aids in determining the urgency of medical attention required, provides timely medical advice to patients in critical situations, and assist healthcare professionals in efficiently allocating resources. Teletriage ensures that patients receive appropriate care based on their symptoms and circumstances, contributing to quicker response times, reduced overcrowding in healthcare facilities, and improved outcomes in emergency situations. The next application is telepsychiatry and medical health support. Telepsychiatry and mental health support via telemedicine entails the provision of psychiatric evaluation, therapy sessions and counseling services remotely. Utilizing digital platforms, this approach enables individuals to access mental health care from their own environment, fostering convenience, privacy and accessibility, particularly valuable for those in remote areas or facing stigmatization. Benefits of telemedicine: increased access to healthcare. One of the most significant advantages of telemedicine is its ability to bridge the gap between patient and healthcare professionals, regardless of geographical distances. Individuals in remote or underserved areas can easily connect with medical experts without the need for lengthy travels. This is particularly beneficial for those living in rural areas where medical facilities might be low or distant. The next benefit is cost effectiveness. Telemedicine often leads to cost savings for both patients and healthcare systems. Patients can avoid expenses related to transportation such as fuel cost and parking fee, which can accumulate over time. Additionally, by reducing the need for physical visits, healthcare providers can optimize their resources, leading to potential cost reduction for hospitals and clinics. The next is reduced travel time and expenses. Telemedicine eliminates the need for patients to commute to healthcare facilities, saving them valuable time that can be better utilized for work, family, or other activities. Moreover, patients with mobility challenges or those in need of specialized care no longer have to travel long distances to access the expertise they require. Improved patient outcomes. Timely medical interventions and continuous remote monitoring facilitated by telemedicine contributes to more effective management for chronic conditions. Patients can receive guidance on medication adherence, lifestyle modification, and early detection of potential issues, leading to better health outcomes over the long term. As we have discussed the advantages, now we will see the limitation and challenges of telemedicine. In this, the first one is technical difficulties and connectivity issues. For telemedicine to be effective, both patient and healthcare professionals need a stable internet connection and suitable devices. Technical glitches, poor video quality, or dropped calls can hinder the quality of care and frustrate patients and providers alike. The next limitation is privacy and security concerns. Transmitting sensitive medical information over digital platforms raises concern about data privacy and security. Safeguarding patient data is crucial to ensure compliances with healthcare regulations and maintain patient trust. The next advantage is lack of physical examination. Certain medical conditions require physical examinations, which can be challenging to conduct remotely. Without hands-on assessment, healthcare providers might miss important diagnostic information, potentially leading to misdiagnosis or incomplete evaluation. The next disadvantage might be limited scope. While telemedicine is highly effective for consultations, follow-ups, and management of certain conditions, it is not a one-size-fits-for-all solution. Some medical procedures, surgeries, or treatments necessitize in-person interaction and interventions. Technological literacy. Both patients and healthcare professionals need to be comfortable using technology to engage in telemedicine effectively. Not everyone may be familiar with video conferencing platforms or comfortable sharing personal health information online. The next challenge is reimbursement and regulations. The reimbursement of telemedicine services can vary based on insurance policies and regulatory framework. As the field evolves, aligning regulation and ensuring fair reimbursement for providers remains a challenge. Now, we will see technologies used in telemedicine. Let's explore the technologies that enable telemedicine. In this, The first technology would be, as you have guessed, it is video conferencing platforms. Video conferencing used in telemedicine refers to the utilization of digital platforms such as Zoom, Microsoft Teams, or specialized solution like Doxy.me or VC, enabling healthcare professionals and patients to engage in remote medical consultation through real-time video and audio interactions. These platforms facilitate virtual face-to-face appointments, enabling visual assessments, discussions of symptoms, treatment plans, and medical advice, expanding access to healthcare services and providing a secure, convenient, and effective means of delivering medical care remotely. The next could be remote monitoring devices. Remote monitoring devices in healthcare refers to technology enables tools such as wearable devices, sensors, and connected medical equipment that allows healthcare providers to collect real-time data on patients' vital signs, health metrics, and psychological parameters from a distance. These devices can track a range of information including heart rate, blood pressure, glucose level, oxygen saturation, and more. The collected data is then transmitted electronically to healthcare professionals, enabling them to monitor patients' condition, detect changes, and make informed decisions about treatment, adjustment, or interventions. Remote monitoring devices play a crucial role in managing chronic illness, post-operative recovery, and preventative care by enabling timely interventions, enhancing patient engagement, and improving overall health outcomes. The next technology we can see is called electronic health records, often known as EHR systems. Electronic health records systems are digital platforms used in healthcare to store, manage, and retrieve patients' medical information and health data. These systems replace traditional paper-based records, allowing healthcare professionals to access comprehensive patient histories, diagnosis, treatment, medications, test results, and other relevant data electronically. EHRs streamline information sharing among different healthcare providers, ensuring continuity of care and reducing the risk of errors due to incomplete or inaccessible records. They enhance communications, facilitates data analysis for research and quality improvement, and enable patients to have more active involvement in their own healthcare decisions. EHR systems contribute to improved patient safety, efficiency, and coordinated healthcare delivery. The next technology we can use are often in our hands: mobile apps and wearable devices. Mobile apps and wearable devices are integral component of telemedicine, offering patients and healthcare providers convenient tools to monitor, manage, and improve health remotely. Mobile apps are software applications that can be installed on smartphones, tablets, providing various functionalities such as tracking symptoms, medication reminders, virtual consultation, and health record access. Wearable devices, on the other hand, encompasses devices like smartwatches, fitness trackers, and medical sensors that individuals can wear on their bodies to collect real-time health data. These devices measure parameters like heart rate, steps taken, sleep patterns, and even more advanced metrics like ECG readings. Both mobile apps and wearable devices enable individuals to actively actively engage in self-care, while healthcare professionals can receive data-driven insights to personalize treatment plans, track progress and intervene when necessary, contributing to proactive healthcare management and improved overall well-being. Now we can see artificial intelligence integration in telemedicine. It is a revolutionizing healthcare by enhancing diagnostic, treatment and patient care through advanced algorithms and data-driven insight. Some key areas where AI is integrated to telemedicine includes: the first one is diagnostic support. Diagnostic support refers to the use of advanced technologies including artificial intelligence and machine learning to assist healthcare professionals in accurately diagnosing medical conditions. In context of telemedicine, diagnostic support tools play a crucial role in enhancing remote medical assessments and consultations. These tools analyzes medical data such as medical images, patient history and clinical parameters to provide insights that aid healthcare providers in making informed diagnostic decisions. For example, in radiology, AI algorithms can analyze medical images like X-rays, CT scan and MRIs to identify subtle abnormalities or patterns that might be challenging to detect with the human eye. This can expedite the diagnostic process and reduce the risk of oversight. Similarly, AI can analyze a patient's symptom, medical history and lab results to suggest potential diagnosis based on the vast amount of medical knowledge and data. The next we will see is predictive analytics. Predictive analytics is a data-driven approach that uses historical and current data along with statistical algorithms and machine learning techniques to make predictions about future events or outcomes. In the context of healthcare and telemedicine, predictive analytics plays a significant role in anticipating patient health trends, identifying potential risk and tailoring treatment strategies for better outcomes. Predictive analytics leverages large data set, often including patient health record, lab result, medical imaging, genetic information and lifestyle factor. By analyzing these diverse data sources, algorithms can identify patterns, correlations and trends that might not be immediately evident to healthcare providers. This allows for the identification of risk factors, diseases progression and potential complications. Virtual healthcare assistant. AI powered chatbots and virtual assistants provide patients with instant information, schedule appointments and offer guidance on symptoms and self-care. The next is remote monitoring and alerts. AI-driven wearable devices and sensors monitor patients' vital signs and health care. AI can analyze trends, detect anomalies and send alerts to healthcare providers when intervention is needed. Treatment personalization. AI analyzes patient data to recommend tailored treatment plans, medication dosages and interventions based on individual characteristics. The next we can see is natural language processing, also known as NLP, natural language processing. It is a branch of artificial intelligence that focuses on enabling computers to understand, interpret and generate human language in healthcare and telemedicine. NLP is used to analyze and process textual data from medical records, clinical notes, research papers, and patient interaction. It allows computers to extract meaning, recognize patterns, and derive insights from unstructured text, facilitating efficient information retrieval, automated summarization, sentiment analysis, and even virtual health assistants that can interact with patients through natural language, enhancing communication and information exchange in the digital healthcare environment. The next we can see is genomics and drug discovery. Genomics and drug discovery is the integral to telemedicine. Involve analyzing genetic information to understand disease risks, tailor treatments, and advance pharmaceuticals research. In telemedicine, genomics aids in assessing individual disease predisposition, optimizing medications choices based on genetic factors, and offering personalized treatments. Concurrently, drug discovery harnesses genomics insights to identify disease related genes and develop target therapies. While telemedicine facilitates remote collaboration and data analysis, this integration enhances precision medicine, enabling healthcare providers to offer tailored care, optimize treatment outcomes, and contribute to innovative therapies, all accessible through digital healthcare platforms. The next is teleconsultation enhancement. Teleconsultation enhancement entails leveraging technology to optimize remote medical consultations, providing patients and healthcare professionals with a seamless and effective virtual interaction. Through various tools and strategies, teleconsultation enhancement aims to replicate the benefits of in-person visits while overcoming the limitation of remote communication. This can involve high-quality video conferencing platforms, virtual examination tools, real-time data sharing, and secure communication channels. Additionally, integrating features such as real-time translation services, digital whiteboards for visual explanation, and interactive patient education materials can further enrich the teleconsultation experience. By focusing on enhancing the quality, accessibility, and engagement of teleconsultation, healthcare providers can ensure meaningful and comprehensive care delivery in digital realm. Now we will see some ethical consideration in telemedicine. These are crucial to ensure the patient care, privacy, and data security are upheld in the digital healthcare landscape. Some key ethical considerations include privacy and confidentiality. Ensuring the confidentiality of patient information is paramount. Healthcare provider must use secure platforms and encryptions to protect patient data during telemedicine interaction and storage. The next is informed consent. Patient must be informed about the nature of telemedicine, its limitations, and potential risk before participating. Informed consent ensures patients understand the process and are comfortable with remote care. The next is equitable access. Efforts should be made to provide equal access to telemedicine for all patients, including those with limited technological literacy, disability, or language barrier. Ensuring fairness in access avoids exacerbating health disparities. Quality of care. Telemedicine services must meet the same standard of care as in-person visits. Healthcare professionals should be adequately trained in remote care practices to ensure quality diagnosis and treatment. The next ethical consideration is continuity to care. Healthcare providers must ensure proper coordination and communication to maintain continuity of care between telemedicine visits and in-person appointments if needed. Professional boundaries. Healthcare professionals must maintain appropriate boundaries and conduct themselves ethically during telemedicine interactions, just as they would in face-to-face encounters. The next is data security and consent. Patient data collected during telemedicine should be securely stored and only used for its intended purpose. Patients should give explicit consent for data collection and use. The next is prescribing practices. When prescribing medications through telemedicine, healthcare providers must adhere to ethical standards, including verifying patient identities and ensuring prescriptions are appropriate. The next is emergency situations. Healthcare professionals should provide clear guidance on what to do in case of emergencies. During telemedicine visits, ensuring patients know how to access immediate care if needed. Next is cultural sensitivity. Telemedicine interaction should be conducted with cultural awareness and sensitivity to ensure respectful and effective communication with patients from diverse backgrounds. The next one is provider-patient relationship. Building a strong provider-patient relationship is essential in telemedicine. Healthcare professionals should establish trust, empathy, and effective communication to maintain the therapeutic alliances. The next is patient autonomy. Patient must have the autonomy to choose telemedicine or in-person care based on their preferences, medical condition and needs. Now, let's revisit what we have done so far. I will ask you a question. What is the main purpose of telemedicine? Option A is to replace in-person healthcare completely. Option B is to provide healthcare services remotely using technology. Your option C is to reduce the cost of healthcare services, and the option D is to increase the workload of healthcare professionals. You might have guessed it correct. It's option B, to provide healthcare services remotely using technology. As telemedicine aims to deliver healthcare services remotely using technology, which ensures access to medical care regardless of geographical barriers. I will ask you another question. Name one benefit of telemedicine. Your option A is increased access to healthcare. Option B is decreased reliance on technology. Option C is limited patient outcomes, and option D is higher travel time and expenses. The correct option is option A, increased access to healthcare. As telemedicine expands access to healthcare, especially in rural or underserved areas, by enabling remote consultation and reducing the need for travel. So, to wrap up, let's summarize what we have learned today. Telemedicine uses technology to provide healthcare services remotely, increasing access and reducing cost. It has applications in remote patient monitoring, teleconsultation, teletriage and mental health support. While telemedicine offers benefits like increased access and cost effectiveness, it also faces challenges such as technical issues and lack of physical examination. Thank you all. We will see in next lecture.